Hi, everyone. We are Group C, and this is Jordan Call. I'm going to start off our Module 2, Interventions, Access to Healthcare During Pregnancy. So here's an overview of our topic. Access to reproductive healthcare in the United States is not guaranteed. In fact, between 2017 and 2021, there was a 10% increase in women facing at least one reproductive healthcare barrier. Additionally, there's growing evidence that the 2022 decision on Dobbs v. Jackson will further these barriers. And as we've been discussing, healthcare inequities are even more prominent among historically marginalized groups, especially pregnant people of color. However, promising interventions at the individual, community, healthcare, and policy levels can all help close these gaps and improve access to maternal care. So through this presentation, we're going to discuss the importance, implementation, and efficacy of evidence-based intervention strategies to address this prevalent issue. So why should we care about access to reproductive care? So low access to care is associated with higher risks of complications, adverse infant outcomes, and increased undiagnosed or untreated conditions. And about 45% of women in the United States face reproductive health care barriers. And what can those barriers be? They can fall at all different levels of the social ecological model. So we have individual barriers, financial ones, organizational, structural, social, and cultural. And the lack of education, physical and mental barriers, provider scarcity, and lack of insurance coverage are all some contributors that can be addressed through interventions that we're going to discuss in this presentation. So we discuss themes around individual-based interventions, ones at the community-based level, policy-based level, and healthcare-based interventions.